When patients come to me with breast cancer, their first concern, of course, is getting rid of the cancer.
Unfortunately, the word cancer elicits fear.
They come in scared to death.
They jump to, oh my God, I need to have my surgery tomorrow.
Just cut it off and I don't care what you do, I just want to be over this.
And sometimes they'll even say to me, I don't really care how it looks. And I'll say, no, you really do. You may not at this moment, but you will a year from now, and you will 5 years from now.
It's traumatizing for women to undergo a mastectomy to begin with.
What it's going to look like, scarring, how is it going to affect sexuality, all go through her mind.
Survivorship has really taught us that we need to pay attention to the after effects of the treatment we do to patients.
And of course, cancer is always the overarching, most important thing. But here's cancer, and here's cosmetics and aesthetics.
Oncologically, can we do this surgery safely? And then can we give them the cosmetic result that they want?
For most patients, we can really do both and do both really well.
You need to understand the mastectomies we're doing now are not the same as what were done 10, 20 years ago.
Don't expect to have the incision that you saw on your mother or your grandmother.
Breast cancer surgery has changed dramatically. We've gone from a radical mastectomy to modified radical to breast conservation therapy.
Most patients who need a mastectomy are actually eligible for nipple-sparing mastectomy.
I'm able to leave the skin of the breast. I'm able to leave the nipple areola complex.
Patients are so relieved to hear, oh, I can keep my nipple?
To have scars on the breast is detrimental psychologically to most of the women.
So how can I most effectively hide that patient's surgical reminder?
The hidden scar technique refers to any approach where you make the incision in a place that is not visible when it heals up.
It allows them to come out on the other side and not have a daily reminder that they've just been through this tough ordeal.
They can look in the mirror after having had a mastectomy for cancer and see themselves.
The cosmetic result looks phenomenal and the patients are really happy with it.
And honestly, in the gym, changing, no one's ever going to know that you had a mastectomy.
There are old paradigms of cancer care that should all fade into history.
People kind of steer patients away from nipple-sparing mastectomies because they don't have a lot of experience with it.
Sometimes the surgeon likes to do what's easiest.
Having seen many, many patients in second opinion who were told they weren't candidates, and then I performed those surgeries, I know what's happening.
It's not really for oncological reasons because we have a lot of data now which really shows that this is a very safe operation.
This is not about me as the surgeon, it's about what's best for the patient.
We can do amazing things, and it's very satisfying, professionally and personally.